Welcome. This is BrainStorm, and I'm Meral Comer. Today's program recognizes April as Minority Health Month, with special guest Marcia Henderson, former Associate Commissioner at the FDA, who will be joining us later in the program. But we're proud to lead off the program with the launch of BrainGuide, a powerful first-of-its-kind platform that aims to support millions of Americans, whether you're proactively working to improve your brain health, concerned about your memory, who isn't these days, seeking more information about receiving a diagnosis, or caring for a loved one living with Alzheimer's. It was recently featured on Good Morning America. Let's take a look.
Now to an exclusive look at a new tool designed to help detect Alzheimer's disease. More than 6 million Americans currently have Alzheimer's, and it is the 6th leading cause of death in the U.S. And Becky Worley is back now with how one organization wants to bridge the knowledge gap for patients and their caregivers. Good morning again, Becky.
Amy, it's the cruelest of diseases. The slow onset of Alzheimer's can be confusing, filled with conflict and shame about memory loss, and that's one of the reasons why cognitive impairment cases are not diagnosed, 60% of them going unnoticed. So this morning, a new online and phone-based tool that's totally free and can help patients or their caregivers get intervention early.
Doreen Monks, nearly 68, says she sees aging differently now.
Having Alzheimer's disease, you find that things which you may not have paid much attention to or felt important about become much more important.
For Brian Van Buren, with a family history of the disease, it was a matter of when, not if.
It wasn't a surprise, but once I got diagnosed, and that confirmed it, but it still felt like a punch in the gut.
Over 6 million people live with Alzheimer's, 65% women. And by 2030, 40% will be Latino or African American.
Unfortunately, especially within the Black community, mental illness and various other diagnoses are not talked about.
But to fight this, BrainGuide. It's a web and phone-based tool. Anyone can log on or call for a questionnaire. You can use it for yourself or answer questions about a loved one. Dr. Rudy Tanzi, a professor of neurology at Harvard, assisted in its development and says it's based on real diagnostic tools.
There's a questionnaire that is based on 2 of the best tests out there. The real need was for those who are starting to have memory issues, or the spouse who notices their wife is having some memory issues. And how do you approach the topic? How do you talk about it?
Too many times the person with the disease is the person who has to make the changes because you're embarrassed. I think that has to change too. You know, we're looking at millions of people. This is a large percentage of the population. You can't push those people into the corner anymore.
Early diagnosis is key. Not only are there lifestyle changes you can make, but treatments for Alzheimer's may be just around the corner. This tool is completely free, anonymous, and this is important. It's available in English and in Spanish, mybrainguide.org, and I've also put a link to that in my Twitter feed, Amy.
Oh, that's amazing, Becky. It's going to help so many people. Thank you for that.
Joining us now to discuss what BrainGuide is, how it works, and why it's so needed today, Russ Paulson, Chief Operating Officer at UsAgainstAlzheimer's, and Brooks Keddy, General Manager of BrainGuide and Executive Director of Women Against Alzheimer's. Brooks and Russ have guided this project from its inception. Welcome to you both. Brooks, tell us about the response to BrainGuide since its launch this month on GMA.
Thank you so much, Meryl, for having me. It's really hard to believe, but in just 4 weeks, we've reached 80,000 people. 80,000 people have come and visited the site, and 36,000 people have participated in either the web-based or phone-based questionnaire. So we're just getting started, but those numbers are really exciting.
Russ, what do those numbers say to you? Because this is a new lane for nonprofits.
Yeah, so it says there's that what we thought would be valuable to people apparently is. People keep coming and coming and coming, and they tell their friends, and then their friends come. And I think that's a big deal. I want to say, Meryl, you gave Brooks and me too much credit, though. Sort of guided this thing from the beginning, but really we were guided in creating this thing by caregivers like you and by patients like Doreen and Brian and all the folks that we talked to and created. Brooks did an amazing job of making sure that at every turn, we were designing this thing based on what we heard from patients and caregivers.
And thank you, Brooks. You also plugged into the A-list and got feedback on BrainGuide itself. Russ, why did you believe it's the right platform at the right time?
You know, Us Against Alzheimer's, as you know, Meryl, has been into earlier and earlier detection, and also trying to talk to folks about their brain health and change the narrative from Alzheimer's is a potentially inevitable thing. Maybe it's something that's going to happen to me. Maybe it's not. There's probably nothing I can do about it. Changing that narrative is a key part of what we can do, because the drugs aren't there yet. We have hope on the horizon for drugs, but the drugs aren't there yet. So we need to get folks doing what they can to preserve their own brain health, to optimize their own brain health. And when the drugs do get there, they're probably going to be targeted for people earlier in the disease. So having folks thinking about this, having folks getting information for this early is important. But I guess the other thing is important to know is, why are we doing this overall? And it's because every minute of every day, somebody in America develops Alzheimer's disease, and they shouldn't have to go through it alone.
You know, Russ, I say we're following the science, because the science is now telling us to go earlier and earlier. Brooks, what makes BrainGuide different from other brain health resources?
Thanks, Meryl. Well, I will say there are a number of things. And as Russ said so well, we really learned from our community. Our community was our North Star in the development of this. A couple things. Number one, it is available in English and in Spanish. That was critical from the outset. We wanted this to be accessible to all communities. The information within BrainGuide, the educational resources, bear in mind different reading levels, different accessibility. All of that was taken into account from day one and tested in the marketplace. The other thing that's very unique is you can take this memory questionnaire privately. You don't need to do it with anyone. So you can go on mybrainguide.org. You can take the questionnaire for yourself. You can take it on behalf of your loved one. And the magic really happens when you've completed the questionnaire, whether it's via phone or web. We curate a set of resources exactly where you are in your journey, so you know how to take the next step. So it's great if you go through the process and then you end up perhaps not scoring well on a memory questionnaire. And so what are you likely to do? Google what to do about my memory loss. And then you're left with 10 ads and lots of content. What we do at mybrainguide.org or via the phone number is we curate select resources matching where you are in your journey. And we go one step further. We describe the questionnaires so you can easily print it, save it, email it to your provider, email it to your loved one. We've had folks tell us, you know, I'm worried about my mom. I don't know how to broach the topic. They take BrainGuide questionnaire for their loved one, and they have this piece of paper now that they can use as a starting off point to spark that conversation with their loved ones. So this is not just learning about yourself, but we take you one step further to say, we know these conversations are hard, and we want to give you the tools to start that conversation with someone. We hope it would be a provider, but anyone you can start that conversation with, that's a step forward.
And Meryl, if I could just add, you asked what's different about BrainGuide. And part of what's different about BrainGuide is there's nobody out there trying to make a buck. Us Against Alzheimer's is making this free through mybrainguide.org or 855-BRAIN-411. It's all free. The number is toll free. I know I'm old enough that 855 doesn't seem like a toll free number, but it is. Everything is free. And we're not referring you to anybody who's trying to make a buck. It's all vetted scientific information, and it's absolutely free.
So Brooks, take us behind the scenes in the development, because you're using the latest technologies to sort of customize the programming to fit individual need. And I've tried both, so.
Absolutely. So we work together with Amazon Web Services, which has state-of-the-art cloud-based technology in order to create both the web bot experience and the voice bot experience. and everything from the language that was used. So for example, if you go through the voice bot and you answer, if you answer in Spanish, but you're in the English version, the voice will recognize you. If you call from a landline and you're done with your questionnaire, the system recognizes you're on a landline and prompts you to add a cell phone or an email of a loved one. The voice technology is so smart and scalable that it pauses based on how long your pacing is. So if you're going really quick, it'll stay with you. If you're going slow, it'll mirror you. We tested, this was probably one of my favorite parts. I mean, there were so many favorite moments in this development, but one of the things when we started this, we said to ourselves, are people going to listen to this automated voice? And so rather than, put our, go like this and wonder, we did a lot of market research and we tested it and found by and large across all communities, people were largely neutral. They didn't mind that it was a voice bot versus a human recorded voice. And then we went one step further and we tested 4 different types of voices to see which one felt the friendliest, the safest, the most secure. So it was really fascinating, brand new learnings for us here at Us Against Alzheimer's, but we were really so fortunate to be guided by Amazon Web Service and their machine learning technologies.
So who won out, a man's voice or a woman's voice?
Well, Meryl, you know the answer to that. It was a woman's voice. A woman's voice named Julie, I think is what they call her in the development room. But yes, that's exactly right.
You have some slides to walk us through so we get a better sense of exactly how it builds, because I think it's very valuable to take a look.
Sure, I'm happy to go through them quickly. And, just again, when we think about the millions of people that are worrying about their brain health, worrying about the health of a loved one, we know in Alzheimer's disease, the steps in the journey are not very well understood. Right? If you asked the average person, what are the stages of Alzheimer's disease? People likely don't know the answer the way they might with a disease like cancer, right? And so we know people have all these questions and they need to figure out the answers and know what their step is in the journey. So we really took that user experience as our jumping off point when we built the platform. So what does BrainGuide offer? Well, I think we said it, but it's good to kind of put it down and let people also see. So we have a memory questionnaire via a phone bot. So you can call 855-BRAIN-411 or 855-272-4641. You go through an automated experience. You can do it from your cell phone. You can do it from a landline. And then you're prompted to either provide your email or a cell phone number of your choosing in order to get the summary of your results sent to you. We also have the memory questionnaire via the website, accessed at mybrainguide.org. Anyone can go to the website today and just look at all the resources that are available. But the tailored experience comes at the end of the questionnaire. So if you go through that questionnaire, that's where you'll get the tailored experience with ideas for your next steps in your journey. This is what the website looks like. We took a lot of care, even in the design of the logo, the look and feel, the choices of our photographs. All of these were tested with users one-on-one as well as through anonymous surveys. This is what the web bot looks like. A little different than what you might expect. We're all familiar when you're online and then, boop, something pops up and you have to do a chat with customer service. We didn't want it to feel this way. We wanted it to feel like a full screen experience that you could go through for yourself in a private manner. It's obviously optimized for mobile and tablet. Interestingly enough, 61% of the people that have used the WebBot so far are using it from their cell phone, which is just an interesting data point, and glad that we prioritized the mobile use. This is just a reminder of what the phone number is. It's 855-BRAIN-411. I am really encourage people to give it a try if you're listening today, or share it with your loved ones. From our market research, we're finding that the phone number is it feels much more accessible to folks, which makes sense. Not everybody has a computer. We're also seeing that among our voice callers, about 20% of them are using the Spanish version, which we're hoping to increase that, but we are really trying to promote the phone because it's an easy and accessible way to get to a lot of people. As I've said, once you've gone through the questionnaire, you receive either an email or a text. We wanted there to be both options because not everybody has access to both. We wanted it to be super easy for you to share it with someone in your life. So bottom line, Meryl, we're not changing the world with BrainGuide, but let's face it, there are millions of people, well, maybe we are a little bit, there are millions of people worrying about their brain health. 60% of cases go unrecognized. This is an unacceptable statistic, right? By 2030, 40% of cases will be Latino or African-American, also unacceptable. It's time, as Russ said so well, to change this conversation. Let's spark a dialogue. This is fast, it's easy to use, it's free, it will always be accessible to all. And we really hope it bridges these conversations that our nation really needs to start having.
You know, Brooks, what was very touching to me is for those who have just received the diagnosis, because you feel so lost in that moment, and you begin to search, but this is customized. So I really think being attuned to what people need, otherwise you just really terrify people about what may be coming next when it may not be relevant to where they are in this process. I would love now to invite into this conversation Dr. Philip Gorelick, Adjunct Professor of Neurology at the Feinberg School of Medicine at Northwestern University and a neurologist at Northwestern Medical Group. Thank you so much, Doctor, for joining us. A lot of emails are coming your way as a result of BrainGuide. Let's look at the classic relationship between the doctor and the patient. This is generational. I come to you with a problem. I tell you my symptoms, or say I may have a memory problem, and then you tell me what to do. This generation, we come armed as alpha patients with all the data, everything we've seen, and say, okay, doctor, what do you think about this? So tell me dynamically where this fits in and why it's important in your mind.
Well, thank you for inviting me to the program, Meryl. I really appreciate it. And as we've heard, patients are on a journey. It's a healthcare journey. And I think the more information that they have, the better off they're going to be. And what could be better than having a single source, a single point source where you can go to learn about the symptoms and signs of a disease such as Alzheimer's or other forms of cognitive impairment, learn about detection, learn about diagnosis, learn about preventive measures and treatment, and learn about patient care resources. So this is really a one-stop shop. And it's very nice because it has everything so well organized. We want to have a discussion about making a good medical decision for an individual patient. So how are you going to do that? You got to have the knowledge. You have to have the information. And BrainGuide is a roadmap to take you through that patient journey. And it will save people a lot of time and a lot of heartache by utilizing this tool.
Doctor, how does it change the dynamic between the patient and the physician who, should be making an appointment, but are too afraid to want to know?
Well, that's a very valid point. And again, it comes back, I think, to the issue of knowledge is power. When you know more about something, you can make a better informed decision. A lot of people think you can't do anything. And we've learned over the years that cardiovascular risk factors such as hypertension, diabetes, cigarette smoking, poor diet, lack of exercise, and so on, these factors can be modified. And in some people, it can be very helpful in terms of warding off these cognitively impairing diseases. So there really are things that we can do. It's been underplayed, under-recognized, but if you go to BrainGuide, you find out about that. It creates hope, it creates knowledge, it provides information to help make better informed decisions by the patient and the patient's family and caregivers.
Where in the history of medicine did the brain disconnect from the rest of the body when it's really command central?
Well, you're talking to a neurologist who's going to tell you that the brain is the master organ. So it never got disconnected in my mind, but I understand what you're saying. And so we've really made some changes in terms of our thinking. And now we're not just talking about brain health and heart health, but we're talking about total health, and we're talking about vascular health. And we think that a healthy vasculature throughout the body, not just the heart, not just the brain, but the peripheral arteries and so on, is probably one of the main keys to remaining healthy and living a long and good life.
So Russ, I don't want to put you on the spot, but let's say you walk into the doctor with an issue. But while you're there, and you're there for something very specific, I won't diagnose you, but you're there for something very specific. But in the back of your mind, you're saying, I'm a little worried about my memory. Now, where in the order of things the doctor has time for does that come?
So my experience going to my doctor, and I've got a doctor, I think he's great, but he's got time to focus on one or two things in a visit. So it is a hurdle for me to bring up a third problem that I'm not so sure about. And I think that's one of the things that we think about BrainGuide is that it gives me a clue as to whether I ought to maybe make this number two when I go in for something that is acute and requires attention now. I can't keep putting it off. So this helps me think whether I need to make it number two on my list that I mentioned to my doctor. But it also helps me, if I'm not talking to a neurologist who knows the brain as the master organ, find a way to talk to my doctor about it where he'll listen. In the world that we live in today, most people see primary care only. And it's very important for me to be able to have the tools to talk to my regular doctors so that if I need to go see a guy like Dr. Gorelick, my regular doctor is going to make that referral.
And Meryl, if I could add,
Sure.
when we interviewed medical experts and did surveys with nurse practitioners outside of the neurologist group, which, you know, obviously we learned so much from in building the platform itself. But when we asked them, what would you need to see in order to engage in this conversation? They shared with us that having a piece of paper that describes these questionnaires that were based on assessments that are validated in the clinical setting, coupled with the patient's own reflection, made it much more powerful. Because, you know, a lot primary care aren't trained in this, obviously, in the same way the neurologists are. So having that extra tool versus having a printout from Google saying, I found all these articles, it just shortens that up and gets you focused faster and hopefully addresses some of the time barriers that are so prevalent in healthcare today.
That's exactly right. If you come to me and say, I took the so-and-so test and I scored such and such and it's low, you got my attention.
Yeah.
And so it immediately elevates that problem to a high level in my mind, and I'm going to address it. But I need that information, so I need a patient who is knowledgeable and can bring that.
So doctor, because physician adoption is always an issue on new technologies and programs coming out, what makes you so comfortable with this and physicians willing to recommend it?
Well, it's easy. It's user friendly. You're not going to fail with something that works well and is simple to use. If you like your cell phone, you got it. If you like a computer, you got it. You can't fail on this. I'm an example of someone who came from a generation that was not born with the so-called joystick, but I find this very easy and very useful. And so you're spanning generations now, which is a good thing.
Let's say we pass, doctor, the test. How long do we wait before we check ourselves again?
Well, I think one of the things you want to keep in mind is that there are other symptoms that can occur or signs that are outside of the test itself. And so if you start failing in certain areas that may not be covered by the test, it's a screening test. It's not going to give you a diagnosis. So there may be other things going on, or other parts of your life where you're struggling a bit. You've got to make note of that. I mean, if you can't find your car in the parking lot, you can't write checks out anymore. That's why we have GPS, by the way, so we can find things. We can't lose things anymore. But my point is that if you find that you're failing in an area that you usually have been sufficient in or have excelled in, and it's not covered necessarily in the BrainGuide test, screening test that you can take, that is certainly a warning that there may be something going on. So I think that you have to view this as the totality of everything you're doing. And if you're doing well and you continue to do well and you're not losing altitude, so to speak, then you're fine. And I think that's what really should be driving the system. Are you able to do all your activities of daily living and continue to do that and have conversations with people and socialize, get out, and so on and so forth.
I love the idea of the platform because it bypasses ageism. The stigma of the disease is, virtual and private. So I think that's great. Let's now add one more guest to this group. I'd like to introduce Marsha Henderson. Marsha, we've known one another for a long time. And Marsha has spent a great deal of time. She was the former Associate Commissioner on Women's Health at the FDA. And this month, Marsha, April is National Minority Health Month, and the theme is active and healthy. So tell me why you feel that this BrainGuide speaks to something to all communities.
Well, let me just take a step back. You're right. We've known each other for quite a while. One of the ways that we met was related to Alzheimer's. And originally, it was related to my position at the Food and Drug Administration. But after we talked a while, I revealed that someone in my family had Alzheimer's and that it was quite challenging. Even though I had a background and a history of working in public health, I was overwhelmed. I had no experience related to this, and people were looking to me to help them navigate the family situation. Because one thing I will certainly say is when someone has a memory issue, has dementia or Alzheimer's, it's a family affair. It's not something that just affects one individual. And, my National Minority Health Month is an opportunity. I think it was created by HHS as an opportunity to take action to spotlight special issues that are disproportionately affecting communities of color. And certainly we know that Alzheimer's is in that category. We know that African Americans and Latinos are affected 2 to 3 times higher than the rest of the population. And so it's a huge concern, not only for the individual, as I said, for the family, but also for the community. And I took BrainGuide. This was some years ago when I had a family member living with Alzheimer's. And in her case, like so many, she had a late diagnosis. As has been said, people are often underdiagnosed. I think in addition to the patient being afraid, the family is afraid. And often they hide the symptoms. I remember I was at church. This was my stepmother. And I was at church with my stepmother, and my stepmother did something that, caused attention. I can't remember whether she said good evening or whatever, when it was early Sunday morning. And a woman said to me, "Oh, don't worry, honey. She's just got a little worration." And I had never heard that term. She has worration. And I said, oh my goodness, not only is my family trying to pretend nothing's going on, people all around her are trying to pretend that nothing is going on. And so, of course, I sought out information. And like so many people, it was overwhelming. Even though I thought I was sophisticated, I didn't know what was accurate, what was science-based. And it was quite a journey. It was a frightening journey, quite frankly. And I did not, even though we went from primary care to a neurologist, frankly, we did not get as compassionate um, an approach as you're seeing from our colleagues on this channel. We were dismissed.
Mhm.
And if I had had BrainGuide, I would have been able to go and process it through myself. I would have known things like, when is it time to consider taking the keys from, having to navigate these everyday real life experiences. And I also, because I've now taken BrainGuide for myself, and then I took it as if I was still a caregiver. And I have to tell you, I think it's well suited for women, since my background has predominantly focused on the special needs, not only of people of color, but of women as well. So that often, as we know, women are not only the patients, disproportionately the patients, but also caregivers. And so when I went online, the first thing I saw was hello. I cannot tell you what that meant. That seems like a simple thing, but it really isn't when you're really struggling. And there was so much information there because it walked me through. It did not just give me a shattered gun of every bit of information that was useless to my particular concerns. It actually walked me through. And when you were walked through, you ended up with results that were specific to your interests, to your needs, to your situation. And so that was very unique. So the fact that in addition to it being online, it's available by telephone. I was just helping my grand aunt um, with some activities. She doesn't have a cell phone. She's got a landline. And I introduced her to this. And for her, you know what she told me? It's fun. Oh, thank you, Marcia. That was a lot of fun. And when you're at home and you're not doing a lot, this was right up her alley.
So,
So apparently,
Brooke, so listen very carefully. So all of that homework you did with all those technologists
yes, yes,
is right on the money in terms of how people are responding. Uh, it has to make you feel good because
yes, it does. And it's
culturally,
free. It's free. So the price was absolutely right.
that's a good sign for all of us. Brooks, tell us about the cultural sensitivity, the use of words, language, because it becomes very sophisticated because you have it in Spanish and you're also appealing to diverse communities.
Sure. And Marcia, it continues to be such a joy to have you on this BrainGuide team. And thank you for sharing that story. We at Us Against Alzheimer's have been committed to health equity from day one. So it really shouldn't come as a surprise that the very first meeting we had with the organizations we built this with, we said we need to build the plan for equity from day one. So we set our parameters. We ensured that 30 to 40% of our respondents to all of our market research were non-white participants. We ensured that we surveyed Spanish speaking users along with English speaking in our quantitative research. And then we worked with partners to do one-on-one user interviews with a whole wide range of people in terms of age, ethnicities, et cetera. We also talked to experts and we really focused on the reading level. We focused on the words we were using. Now, the two questionnaires are based on assessments that exist in the clinical setting today and are known to have less cultural and educational bias. So we looked at 200 of them and we landed on these two for among the reasons. And then we also have been working with community leaders from diverse communities to say, now that we have this platform, what's the best way to ensure it reaches the communities we want to reach? And so that work is just beginning, right? And so we're continuing to do that. But yes, you're right. I missed one of your questions, Meryl. You asked about the words. So we have memory tests in the questionnaire that you take for yourself. And there are 10 sets of words, 4 in each set, that you are asked to remember and then reflect back after a set of distraction tasks. And we took great care into ensuring that those words were appropriate across education and culture. We just actually got feedback in recently, because this is version 1.0, that we should make sure we account for words that might be commonly misspelled, which we had already begun that process, but we're taking another look to ensure. If there's, a word like billboard and someone writes it as one word and not 2, or 2 words and not 1, both are acceptable. So we tried to really think of all those different, they're called utterances in the actual technology, but we've tried to build the platform in a way that allows it to continue to get smarter and smarter as it relates to how people may answer things differently.
Dr. Gorelick, what has been your experience in communities of color related to both the stigma around the disease and unwillingness to come forward? What issues, besides the comorbidities of diabetes and heart disease, what are the issues that you see, and how have you been able to really bridge that gap?
Well, I've had a fair amount of experience working in the African American community, for example, have had NIH funding during periods of time, and we focused on cognitive issues. And what we found was that people were really very willing to come forward as long as we brought the resource to the community. And so that was a very important lesson. Another very important lesson that we came to understand is that the faith-based community is extremely important. Marcia said she was in church when she had one of her experiences. And we worked very, very carefully with the African American churches and explained things and got everybody on board before we went into the community. So I think it's very important to explain what you want to do, get buy-in, and have people understand where you want to go. And we were blessed to have members of the community on our advisory board. And so they had a seat at the table. And so we worked together. This was real community engagement kind of work. And so that opened the gates for us to allow us to test patients, help patients, and try to get a better understanding of what was going on in the African American community. And in fact, the work that we did in part led to this issue that these cardiovascular risk factors, which are of course preventable or reversible, may be a key to slowing down or preventing these cognitively impairing diseases. So, but there are, you have to give people the time to absorb and understand. It's very, very important. People aren't going to, jump on the bandwagon, if you will, and get rolling with you. You've got to spend the time. You've got to be patient, and you've got to be very sincere and trustworthy.
I think trustworthy is a big, big issue. Russ, health equity has been built into the DNA of Us Against Alzheimer's since its inception. Why do you feel that cultural sensitivity really hit the mark and is so relevant today?
So probably your listeners all know this, that Alzheimer's disproportionately affects people of color. Black folks are double the likelihood of getting Alzheimer's disease as white folks. And Latinos are 1.5x as likely to get Alzheimer's as non-Latino whites. So if you care about ending the disease, you got to go where the disease is. And the disease is among people of color. We have no choice but to go there.
Marcia, in what ways does the Brain Guide speak to empowerment, fairness, health equity? We hear these words attached to so many things these days, but take it apart for us.
Well, I've always said that you can only empower yourself. People don't give you power, you have it, but you can enhance their opportunity to take control of their lives. And that's what people really want to do, whether it is an individual who can become more comfortable, as Dr. Uh, Gerlich, I always mispronounce that, but that's okay. He's told me that's okay, has indicated once you are aware of your situation, particularly in the earlier stages, you can take steps that can help to minimize your problems, whether it is getting better control of your diabetes or your hypertension. That can make a huge difference. And also with your families, the caregivers that support you, actually understanding what's happening and being ready for potentially the next step, because that was always our fear. We have things under control at the moment, but what may be coming down the road, and what does that mean for our family? The Brain Guide helps you determine what happens at various stages, and that is crucial, I think, to anyone who wants to address this problem as an individual or as a family.
Brooks, let's fast forward. It's only a month old, but let's fast forward anyway. And what are the metrics by which you will judge success of this program?
Yeah, so it's a great question, Meryl. And I would say, our vision certainly for this program is to change the current statistics around early detection and diagnosis, right? I mean, it is no longer acceptable for 60% of the cases to go unrecognized. So, really that's lofty, but we want millions of people to be using this service to change that conversation. We absolutely have metrics that we're checking on a weekly basis. We want to learn how many people are coming to the site. We want to know where they're coming from. We want to know what materials they need. We want to keep talking to providers like Dr. Gorelick to say, what do you need in the community to bring this to the people that you serve? We want to ensure that a significant percentage of people using BrainGuide are people of color and women. We really want people to be coming to the site and getting those resources. So we'll be looking at all of that on an ongoing basis. And then we always have our long-term vision in terms of the enhancements that we're making. This is our first version of BrainGuide out of the gate. But as we start to look at the data and learn from the tens of thousands of, hopefully hundreds of thousands soon, of people that are using it, we will continue to keep the user as our North Star. And if we need to add more features or add more tools, we'll continue to iterate and do that. So we're just getting started.
I want to say, Brooks, that, those are numbers, and the numbers are really important. Obviously, if you're going to do something at scale, you got to get the numbers. But more people who say what Marcia said earlier, if people can go through this and say, I don't feel like I'm doing this alone. That's what this is all about. This is about people not feeling like they're alone in this really, really difficult journey. We talk about it a journey as if there's like a nice, clean roadmap, and you know how to get there, and you got the GPS that Phil was talking about. But the reality is there's no GPS, there's no map, there's a mess. And whether it's figuring out how to maintain your brain health as long as you can, optimizing your brain health, or whether it's, I'm not sure that I'm okay, or I'm not sure my fill in the blank that I care about is okay. It's not clear cut. If we can help hold people's hands while they go through that, that's success.
I totally agree.
We all agree. In fact, it's giving me the chills, because if you went back 24 years, when my husband became ill, there was nothing. And Marcia and I we can all attest that when we needed it, we were handed a diagnosis and there was nothing. And it's so dramatic, and we're thrilled. Thank you for all of the work. Thank you for joining us today. We are out of time. That's all we have time for. A terrific panel. Thank you, Dr. Gorelick. Wanted to make sure I got your name right. Join us next month for BrainStorm.